from the station working for you. This is WRTV News at 6, streaming now.
We need to start eradicating this, this virus as quickly as possible.
The frontline workers in Indianapolis received their first dose of the Pfizer vaccine today. How they feel about this historic moment.
Since healthcare workers are now getting vaccinated, what about the general population? We're learning more about the process that determines when you could get the vaccine.
I know it's had to happen in other places too, and it really scares me because this is something that can happen.
A retired nurse is in disbelief over what she calls a COVID-19 testing mishap, what she says happened and what you need to know.
I never struggled harder than I am doing right now. It's heartbreaking.
Thousands of Hoosiers could be forced from their homes within days. The looming deadline and the options available. Good Wednesday evening to you and welcome into WRTV News at 6. I'm Mark Mullins.
And I'm Amanda Starantino. First tonight, aside from a few flurries, the bulk of the snow has moved out, but we still have plenty of it on the ground. Chief Meteorologist Kevin Gregory is here. Kevin, what's next?
Well, Amanda, we deal with the cumulative effects of the snow, but I want to start by giving you a view of individual snowflakes. Check this out. Jason Scheuer took this picture. Can you imagine how many of these individual snowflakes it takes to eventually come up with this? Almost 4 inches of snow up in Kokomo, Indianapolis. Officially just under 2 inches of snow. In Clinton County, 2.5. So that's in the rearview mirror. This is happening now. You go off into eastern Indiana. Light snow along I-69, I-70, I-74. Biggest impact there would be some very light accumulation, but a drop in your visibility as well. Tonight, we're likely to add, especially over the northeast half of central Indiana, some light freezing drizzle. That may lead to slick spots in the morning, so this isn't totally behind us yet. We'll talk about warmer days ahead coming up.
Well, the COVID-19 vaccine is here in central Indiana, and today frontline healthcare workers started receiving their first dose of Pfizer's vaccine. Our Alyssa Donovan is live at IU Health's Neuroscience Center downtown, the site of one of the first vaccination clinics in the state. And Alyssa, this was a very emotional day for these workers.
That's right, Mark. Not only for those frontline workers receiving the vaccine, but also for those administering it. One worker I spoke to today says this is the first time in months that she's felt a feeling of hope coming into work today. Now, this clinic is still open at this hour. By the end of today, 192 frontline workers will have received their first dose of the Pfizer vaccine.
I'm ready to rock and roll this bad boy.
EMT Perry Rogowski, one of the first frontline workers to receive the Pfizer vaccine at IU Health's vaccination clinic.
I think that as healthcare providers, we have an obligation to kind of lead the way.
Her joy and excitement.
Can you see me smiling?
Echoed by many in the room today, including those administering the vaccine.
It's the first day I feel like I've came into work where we might start to win this battle.
Infection prevention nurse Carrie Kubler has been responsible for calling the State Board of Health to report COVID-19 deaths from Methodist and university hospitals, reporting more deaths so far this month than at the beginning of the pandemic back in April.
Having to call those in daily is just a very sad thing. So to be able, just the feeling of giving that first injection today and feeling like our director has described it as the first volley for a big win, just felt really good.
It's nice to know that there's going to be a little bit more protection for us that are working, so that's helpful.
The people who received a vaccine today scheduled their next appointment immediately on their way out. Each of them will have to return in 21 days to receive their second dose to ensure immunity.
I am thrilled to get this. I really am.
And IU Health will be receiving another 975 doses tomorrow for this clinic, and we'll also be receiving another 3,000 doses on Monday for this clinic as well. And all of those healthcare workers I talked to today shared the same sentiment, some of them saying that they feel like this is the beginning of the end of COVID-19. Reporting live, I'm Alyssa Donovan, WRTV.
Alyssa, thanks for that live report. As healthcare workers start to receive the vaccine, many are wondering when everyone else will be able to get vaccinated. Today at Governor Eric Holcomb's weekly COVID-19 press conference, the Department of Health's Chief Medical Officer, Dr. Lindsay Weaver, addressed that issue. There is no clear-cut date on when the general population will have the opportunity to get the vaccine, but Dr. Weaver discusses the process of how that will be determined.
This is a rapidly evolving situation, and it's why we have focused our initial vaccination efforts on frontline healthcare workers and long-term care facilities. As more vaccine becomes available, we will continue to roll out eligibility to additional populations. The next Centers for Disease Control Advisory Committee on Immunization Practices meeting convenes on this Saturday. As we did in the first round, we will wait to receive CDC recommendations about which populations to prioritize for future allocations of vaccine. We ask Hoosiers to be patient while this process evolves. You will get your turn to receive the vaccine.
Dr. Anthony Fauci has previously said the general population will likely be able to get vaccinated sometime in the spring or summer. And many of you have questions about the COVID vaccine, and that's why on our website, WRTV.com, and on the WRTV app, we are answering as many of those questions as we can. It's in a question and answer format, so you can easily see and find the information you want to know. Now, it's available to you right now in our app, or go to WRTV.com/coronavirus.
Tonight, a Martinsville woman is quarantining after she says she called the Morgan County Health Department and found out she tested positive for the coronavirus. Here's the bizarre part of the story. She says she was waiting on test results, but no one ever contacted her. WRTV's Troy Washington explains what Hoosiers should do if you find yourself in a similar scenario.
Just kind of like in a state of denial, why no one notified me.
Kathy Thorpe is a retired nurse, but she's back helping out on the front lines inside of hospitals. That was the case before she picked up the phone a few days ago, called the Morgan County Health Department, and found out she had COVID-19.
So I called the health department, and one of the nurses gets on the phone, and I told her, I hadn't gotten any results, had nothing. So she looks it up. She goes, "Well, you're positive." I was like, "What?" And I was nice to her, but I kept saying, I just can't believe this.
She took the test last week at the Morgan County Fairgrounds, then waited patiently to find out if she was positive. She almost assumed she was in the clear when no one got in touch with her. Now she's upset because she thought for sure if she was positive, someone would have let her know it.
I have no symptoms of anything. I don't feel sick, nothing.
WRTV reached out to the Morgan County Health Department. They tell us it's not uncommon for some people not to receive their results, even if they are positive, but those who take the test should reach out to them if they don't hear anything back, instead of assuming no response means negative.
People are dying from this stuff. I know accidents happen. This is a pandemic. You don't have airs like that could affect, like I said, hundreds of people that I've been around.
Thorpe doesn't necessarily agree with that approach, but wants to make sure Hoosiers aren't waiting around for results.
This is serious. Not just down here in Martinsville. I know it's had to happen other places too. And it really scares me because this is something that can happen. It's an error, it's a mistake.
Working for you, Troy Washington, WRTV.
Morgan County is one of the areas trying to decrease their number of COVID-19 cases to leave the red category in our state. That's the most serious level. Their positivity rate is currently at 15.6%.
For a second straight day, the state reports more than 100 additional COVID-19 related deaths and thousands of additional coronavirus cases. Data from the Indiana Department of Health shows 125 additional deaths. So far, 6,781 Hoosiers have died with COVID-19. The Department of Health also confirmed 6,283 additional cases of the coronavirus. More than 440,800 people in Indiana have now been diagnosed with COVID. Data also shows a slight decrease in the number of people hospitalized in Indiana with a COVID-related illness. As of yesterday, 3,192 Hoosiers were hospitalized either with the coronavirus or similar symptoms that could turn into COVID. That's 37 fewer people in the hospital than on Monday.
As the expiration of the CDC national moratorium on evictions looms, thousands of Hoosiers could be forced out of their homes in just a matter of days. WRTV's Stephanie Wade speaks with someone facing the threat of eviction in the middle of a pandemic.
I'm isolated, confined in this apartment, trying to make ends meet. And it's hard.
Jennifer Morris is not alone, as up to 250,000 people are behind on rent in our state, according to Prosperity Indiana, because of unemployment or lost hours due to the pandemic.
In my 53 years, never had an eviction, never. Never struggled as hard as I am doing right now. It's heartbreaking.
Morris was a personal driver before the pandemic hit.
Well, I'm disabled and I'm a real bad diabetic. And I was a driver, delivering parts and stuff, and they put me in the field where my doctor didn't want me interacting because I was high risk.
But is worried to be in close quarters with people as she is at high risk for the virus.
It's just crazy. I have reached out. I have a list of people I have reached out to.
She says she's reached out to numerous resources for rental assistance help.
Where I'm at by Post Road, off the 38th and Shaden, there's no help out here. Definitely.
But says she has nowhere else to turn.
There's just nothing out here.
When the CDC national moratorium expires at the end of the month, experts say anywhere between 40 and 80,000 Hoosier households are at immediate risk of eviction. If Congress does not release additional rent relief, the state will soon have to make some hard decisions to prevent thousands of Hoosiers from becoming homeless come January 1st.
We've heard about a plan that could provide $25 billion for rental assistance, and that's about a quarter of what we need to get through 2021. So if our Indiana senators act, Todd Young and Mike Braun, can be champions on those bills, then that could really make a difference for at least 100,000 Hoosier families that are at risk of eviction.
Stephanie Wade, WRTV.
We've connected Ms. Morris with resources we've collected that provide rental assistance. We will also attach those resources at the bottom of this story on our website at WRTV.com.
AARP has launched its own nursing home dashboard to see how Indiana compares to other states when it comes to COVID-19. The goal is to identify areas of concern in a timely manner. You can look at the rate of nursing home deaths per 100 deaths. Indiana ranks 7th worst in the country. AARP Indiana State Director Sarah Waddle says that needs to change.
In Indiana, we're still over 50% of the deaths happening in a long-term care facility. That is higher than the national average of 40%. And so there's always room for improvement there.
AARP's dashboard also looks at things like staffing shortages, PPE, and COVID-19 staff infections. You can find the link in this story on the WRTV app and our website, WRTV.com. Now that a vaccine is finally here, you may be thinking about traveling again, but look at the deals very carefully before committing. And one man's story and the warning he wants you to hear.
A smile that the Colts are happy to see. Punter Rigoberto Sanchez returning to the team today. Coming up in sports, hear what he has to say after successful cancer treatment has him back on track. Kevin.
And you don't see it here, but you'll feel it sooner than you think. I'll detail a warm-up in the forecast.
From the station working for you, this is WRTV News at 6, streaming now.
You might be planning in advance for your next getaway, especially with the emergence of a COVID vaccine. And right now, the travel industry is offering low rates, but you need to be aware of certain deals. Mallory Safasti with our Scripps partners in Baltimore has a warning about travel scams on day 7 of the 12 scams of Christmas.
You know the saying, if it's too good to be true, it probably is. But right now, it can be harder to tell. With the travel industry trying to rebound from the pandemic, there are a ton of deals, but not all deliver what's promised. For those dreaming of a tropical getaway or escaping anywhere outside your home, these ads are very enticing. Elvin Price wasn't looking, but thought he'd come across a great deal.
I received a random phone call from a company travel agency that was looking to sell a package, and this vacation package could be used within 5 years. and you could select from a number of different locations.
The trip for 4 included everything, so he bought it for just $700. Then he tried making a reservation.
I just received an email about a month and a half ago saying that the company that I bought the vacation package from is out of business.
A reservation specialist claiming to be with a different company said they were taking over for Resort Go International, and if he wanted to move forward, he'd have to send an additional $349 within 24 hours and to the same billing name.
They're claiming that they're out of business, but they're still in business to take more of my money. But they're out of business for carrying out their end of the contract.
With any travel offer, look for reviews and ask for references. Never wire any money or use a prepaid debit card. With these forms of payment, you have no way of getting money back. And dig into the company, their address, phone number, social media sites, images on their website, odd language, or spelling errors. And Elvin doesn't recommend buying from anyone who contacts you without reaching out to them first. To this day, he said he continues to get phone calls.
A similar company trying to sell me a similar vacation package for around the same amount of money. So they're relentlessly hitting up my phone. And so I assume they're probably making these calls to other people too.
I called and emailed the company. They hung up on me and didn't respond. Elvin filed a claim with his bank, but he hasn't heard yet if he'll be reimbursed. With your 12 scams of Christmas, I'm Mallory Safaste.
Let's just say you have a snowman vest and you've been itching to wear it. Today's the day. It's been a long wait since our last 1-inch snowfall. If you've counted the days, 277 days since that last happened. The wait is over, but the meltdown is already underway. I gave it an attempt. It wasn't a great attempt. I'm not an artist. The heavy snow was hard to roll because it's pretty wet. Just let's say his posture is not the same at this hour. Temperatures in the upper 20s right now. Will stay a little colder overnight. And I just want to warn you, even though the accumulating snow is over, other than a dusting to the east, we may have some light freezing drizzle. That could lead to slick spots in the morning because temperatures will be in the mid-20s to upper 20s overnight. There's a look at the radar. Everywhere you see the blue is light snow in Indiana. I want to point this out. New York City right now getting 1 to 2 inches of snow per hour, quarter-mile visibility, wind gusts to 40 miles per hour. It's going to be rough. Philly to New York to Boston, even all the way back into central Pennsylvania as well. Much different here. We're on the light side, the very western edge of that whole storm system. Temperature tomorrow morning down to 24 in Peru. 27 in the metro area. Temperatures tomorrow really don't change much. We'll struggle through the day because the cloud cover is with us. Can't rule out that we would see a snow flurry or two, but nothing really of consequence. And temperatures will not have much of a range from north to south or west to east. Look, a little sunshine to end the work week. Friday 41, the chance for a rain-snow mix Saturday. We have a minor temperature setback on Sunday, but we'll see temperatures take off early next week. Friday forecast includes a noontime temperature at 34, a mixture of clouds and sunshine 41 for the afternoon high. Little warmer southwest Indiana. Temperature should be low to mid-40s there. There's your chance of a mix Saturday. Sunday's high 39, and then Monday we jump all the way to 48. Keep our eye on a chance for a mix on Wednesday, right in the middle of next week. But notice the temperature all the way up to 48 for the afternoon high, and temperatures at or above average right on through Christmas. Mark, just let me know. You can borrow this for a holiday party. Just let me know.
Hey, how about when the temperatures warm up, I borrow your beach one next week?
Your outfit's
All right.
Right. Hey, some great news from the Colts complex today as one key player returns and expresses his thanks to the organization and fans. Plus, the college basketball season turns another page tonight. Brad Brown has a look at your Wednesday evening sports.
As the Colts returned to practice on Wednesday, punter Rigoberto Sanchez was back with the team. Just a couple weeks removed from treatment for a cancerous tumor. He was in great spirits talking to the media on Wednesday afternoon.
I'm just so thankful that they caught it early and, it didn't spread anywhere around my body. I'm just so grateful for the doctors here in the Colts locker room and in Indiana as well. I mean, it's incredible how things plan out sometimes. You know, I could have gone to any other team, and Indiana is like where it's at for medicine. So I'm just so grateful to be here with you guys. It's amazing to be back.
The Colts host the Texans on Sunday. College hoops tonight. Conference schedules getting underway on the men's side. Butler is getting its first game in 3 weeks. The Bulldogs are at Villanova. BU's been on hold since Thanksgiving. A positive COVID test on the team after their opening game. 3 games taken off the schedule and a couple more postponed. And Purdue is starting its Big Ten schedule at home. They're taking on 20th-ranked Ohio State. The Big Ten has 7 teams in the AP Top 25 this week. Matt Painter knows his team will need to play a full 40 minutes for a win tonight.
It'd be huge. It'd be huge. Like, you know, you have to have a start. And obviously this is our start to the season, and, you know, being able to get that win and try to build off of that and get to your next game. And obviously we don't play a Big Ten game the next, but obviously it's a ACC team, and that's where our 2 losses, you know, have come from. You know, we know what's in front of us, but we also got to keep things in order.
IU won't open the Big Ten season for another week. They'll host Northwestern next Wednesday. Brad Brown, WRTV Sports.
Blue is snow, not accumulating snow with the intensity that we had early this morning, but some flurries, snow showers may reduce visibility just a bit. Our temperatures in a holding pattern, staying in the upper 20s to around the 30. I do think we'll introduce some patchy freezing drizzle as we go through the overnight, so we've got to watch that. Could be some slick spots in the morning, especially anything untreated. Temperatures during the morning hours tomorrow, they'll start in the 20s. We only work our way to 32 by the time we get to noon, and lots of clouds all throughout the day tomorrow. Mark, Amanda?